Welcome to our final live stream of the day. It is now June 25th, 2025. 24th, sorry. I'm Dr. Duke Machen, CEO and founder. Our last patient travels here from North Carolina. Now he's had his, South Carolina. He has been here before. We fixed his neck. He had cervical Duke laser disc repair. He did great. So happy with the results. But now we're going to fix his lower back. All right, buddy, just lay still. Let me know if you're having any discomfort, and we'll give you some more numbing medicine. We're going to fix two discs, L45, L5S1. That's where his pain is coming from. He actually has 3 herniated discs, but the top one doesn't seem to be causing any symptoms, so we're leaving it alone. We're just going to fix 4551. Shot. All right, we need to be a little lower. Shot. And probably even a little bit lower. Shot. Just lay still. You're doing fine, okay? I promise. All right, we have some more num-num. He has 2 tears that are causing his pain. I'm going to give you a little more numbing medicine. We're going from the right side. You're going to give him any anesthesia at all? Let me know when I can proceed. Now, Henry, while we're waiting, why don't we show our audience the 30 different things that can cause back pain. I'm Dr. R. Duke Machen with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L45, followed by L5S1, then L34. The L12 and L23 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4 mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. Right now we have accessed L5S1 disc, transforaminal. I had to do a little changing of where the needle was going in and aiming because his anatomy is a little bit different, you know, than some other people. But it's in the end it's fine. We got it done. His spine is quite posterior towards me, which is good. It makes it usually a little bit easier. Shot. That said, shot. Everything's going well for him. Oh, shot. So that should be, let's get an AP. That should be the 045 disc. He's got 2 discs that I believe are causing his pain. Bernadette, will he be awake? It would be nice. Oh, that's perfect.
How are you, my friend? You okay? We're going to ask you a few questions, all right? Can you open your eyes for me?
Do both.
Open your eyes for me? Good. Open your eyes, my friend. Are you having any back pain right now? Any pain right now?
So he's got, as I said earlier, 3 discs that are herniated.
Can you open your eyes for me?
L3-4,
We're going to ask you a few questions, all right? Any back pain?
L4-5, and L5S1. Now, when I asked him, where is your back pain, this is what he told me, here. So I looked and I'm like, well, 3-4 is herniated, very bulgy, very minimal, but it's not where his pain is, so I'm not going to treat it because it's not causing pain. I'm just going to treat where he's having pain. So we just placed the 2 needles and we made our small 7mm incision. This is all the blood we've lost for the whole surgery. This is bloodless surgery. It's done outpatient, no hospitalization needed, no postoperative pain killers. We're not going to give narcotics. He doesn't need them. Are you comfortable?
How are you doing, my friend? Can you open your eyes for me? Open your eyes? Good. We're going to ask, don't move, don't move.
Lay still.
Stay still, don't move.
How bad is that? How bad is that on a scale of 1 to 10?
Give us a number.
Shot. Jordan, look at that.
What's
Okay.
the number?
10?
What did you say?
How high did it go?
What number?
Okay, guys, look at that tear. That is a massive top to bottom. Look at that, top to bottom. Now look underneath the bone. Show us the bone, the bottom of the bone. No, bottom of the bone, L4, L4, L4. Look at that bone. See the black line right there, that dark line? That's the bottom of the bone. Then you have a gap of white. That's the annulus that's torn. And then you got the torn edge and you got a humongous tear from top to bottom, basically. 10 out of 10? Yeah. Is that where you get your pain?
Is that where you get your back pain?
10 out of 10.
Is that where mostly you get your pain?
Is that where you get your pain? Is that where you get your pain? Yeah, I heard him say yes. All right, so concordant, that was L4-5. Let's see what 5-1 does. You having any pain? How bad is that on a scale of 1 to 10? Look at him coming off the bed. How bad is that? How high did it go?
How did the number go? Did you give that a 10?
All right, folks, you don't even have to get a 10 out of him. As soon as I pushed some dye in his disc, he literally tried to come off the bed. It was so painful. So we know that both discs are causing back pain. So 5-1 was a 10 out of 10 per the patient, concordant. That's great news. That means when he wakes up, that pain will be gone from our laser surgery. This disc is the #1 cause of back pain of all causes of back pain in the world. If you take 100 people with back pain in the world, out of 100 people, 85 of them, 85%, it's going to be the disc is the main cause. And this surgery you're watching right now is the future of curing back pain from a disc problem. Today you saw, if you followed us, we did 5 surgeries. Our 6th one we're doing on Thursday. But we did 5 surgeries today, and these patients are all from around the world. Okay? We didn't have any patients from Florida. They're all from different states or different countries, and they're finding out about this surgery here at Duke Spine, the Duke Laser Disc Repair, to cure back pain coming from a damaged disc. And that's why these people come here. They come here because they want to get rid of their back pain, like we've done for thousands of patients in the past. They want to get rid of their back pain permanently. He's no exception. Hold on. Shot. Go ahead. All right. We're placing our dilator followed by our tube. This tube is called the tubular retractor. Okay? Shot. Looks good. You can see from that x-ray we're inside the tear. A lot of people think, oh, Dr. Duke, aren't you damaging the disc when you go in with that metal tube? The answer is no. We're going in through where the tear is already. We're not doing any additional damage. The damage is already there. What we're going to do is we're going to clean that tear, so now it's going to heal. You guys could see on the discogram it never healed. He's had this back pain for a while, and it's never healed. So, because the tear never healed. Now we're going to get it to heal. Here we are inside the tear. L5S1. Look at all that inflammatory tissue. There's the tear right there. You guys see the tear?
Yes, we do.
It's like a crack. See all the pinkish color tissue? That's inflammatory tissue. Thanks, Nikki. Any questions?
At this moment, no current questions. In the meantime, why don't we show the audience of how it is a herniated disc causes back pain?
I love it, Henry. Thank you.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You see from our video that the disc is the cause of back pain through a process called inflammation. You get a tear, the tear then gets a piece of herniation stuck in it, that comes out from the center of the disc. And then the pain cycle of inflammation starts. And it never stops. And these people have back pain for their whole life, from the day of the injury of their disc to the day that they get it fixed at Duke Spine. All right, so far everything is going good for him. Henry is going to have to bail, folks. So we're going to end this live stream early because we can't just end the surgery, but Henry has to leave. He's got a family member that needs attention. Right, Henry?
Yes, he does.
And we're going to let Henry go take care of his family. So we'll do another 5 minutes of streaming, and then we're going to have to end the stream. So if you have questions, please ask them now. But this is our last surgery of the day.
And at this moment, no current questions.
Did you show them how we fix disc tears with laser?
Not yet.
Let's do that.
Of course.
And then we'll wrap it up.
Copy that.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. We're just removing pieces of herniation from the tear at L5S1. So far, surgery is going well. Henry is going to have to leave. So if you have questions, this is your last chance. Ask them. Otherwise, we're going to have to end the stream. I apologize for the premature ending, but I think we had a good day of surgeries today, and we got to see a lot.
That we did.
Patient's doing well.
Yeah, patient's doing well. All right, there's no questions. We'll go ahead and end the stream. Thanks, Henry.
Of course. Thank you guys. Have a great night, all right?
Uh-huh.